Chapter 18, Part 2 covers obsessive compulsive related disorders. Obsessive compulsive disorder was previously classified as anxiety. However, it differs from anxiety significantly. Certain disorders are classified by repetitive thoughts and behaviors such as OCD and can be grouped together and described in terms of obsessive compulsive spectrum. Obsessions are recurring, persistent, intrusive, unwanted thoughts, images, or impulses, whereas compulsion is a ritualistic or repetitive behavior or mental act that a person carries out continuously in an attempt to neutralize anxiety. Assessment data: recurring obsessions and compulsions that are severe enough to be time consuming and cause marked distress or significant impairment. This is the data that we're gathering as the nurse or as the clinician. So these findings will likely impair social, occupational, or important areas of function. The individual recognizes the behaviors are excessive and unreasonable, but are compelled to continue to act in this manner. Common compulsions include washing hands, putting things in order, checking, rechecking, such as locked doors and windows, praying consistently, counting things consistently, and repetitive words silently. So just whispering words to themselves. Etiology of obsessive compulsive disorder and related conditions. So psychoanalytics, they believe that OCD patients have weak, underdeveloped egos. They also believe aggressive impulses are channeled into thoughts and behaviors that prevent the feeling of aggression from surfacing and producing intense anxiety filled with guilt. So the learning theorist explains obsessive compulsive disorder as a condition response to a traumatic event. The traumatic event produces anxiety and discomfort, and the individual learns to prevent that anxiety and discomfort by avoiding the situation that associates with that particular traumatic event. This is considered passive avoidance. The individual may also actively avoid situations that will cause them this anxiety and discomfort in regards to traumatic events or triggers. Obsessive compulsive disorder spectrum approach. The spectrum approach includes repetitive behaviors of various types. So we'll talk about just a few, as your textbook mentions a few. Self-soothing behaviors. An example of this is trichotillomania. So this is the pulling out of hair to relieve stress. And pulling out of hair gives this patient gratification. Reward-seeking behaviors, such as hoarding. And so everyone's familiar with hoarding. However, this is a reward-seeking behavior. So it's just having things in excess of what is actually needed or required. Then you have your disorder of body appearance dysfunction, such as body dysmorphia, also known as BDD. So this person is focused on their flaws. They spend hours a day focused on their flaws. Body dysmorphic disorder, or BBD, affects 1 in 50 people. These individuals cannot control their negative thoughts, and they believe they cannot believe when people tell them that they look fine or accept compliments. These individuals think about a real or perceived flaw hours and on top of hours every day. These thoughts cause them extreme emotional distress and they interfere with their daily functioning.
They sometimes miss work and school and social events and isolate themselves from family and friends because of fear that others will notice their flaw. Hoarding disorder is a progressive, debilitating, compulsive disorder, and it affects 2 to 5% of the population. The chances of developing a hoarding disorder increases with age, and it is more common in females with a parent that had a hoarding disorder or hoarding tendencies as well. Trichotillomania, which is pulling hair out disorder. The reoccurring pulling out of one's own hair that results in noticeable hair loss. It is preceded by an increase in tension and a result in gratification once the person pulls their hair out. So this disorder is more common in women. They can pull their hair out from anywhere the hair grows on their body, eyebrows, eyelashes, their scalp. It could be anywhere the hair actually grows. People with this disorder usually have comorbid psychiatric disorders, which basically means that they have more than one disorder. So they may have a mood disorder, eating disorder, anxiety disorder, substance abuse disorder, personality disorder. Psychiatric disorders are best managed with both pharmacological and non-pharmacological techniques such as psychotherapy or behavioral therapy. So for the prescription drugs, we have our antidepressants, which are the SSRIs that are used for these OCD related disorders, and our tricyclic drugs. In addition to that, anxiety medication are often used. They also are called analytics. And I want to mention that Xanax is one of those, and Xanax is highly addictive, so it's only ordered for emergent situations for a very short duration. And some hypertensive drugs or antihypertensive drugs are utilized to treat some of the symptoms that are associated with anxiety, especially severe anxiety or panic anxiety. So our beta blockers and our alpha adrenergic receptors, those drugs are used to help manage these symptoms that are associated with extreme anxiety. Anti-anxiety drugs or analytics are used to control not only anxiety but also OCD related behaviors. Anti-anxiety agents also are used to treat acute alcohol withdrawal, skeletal muscle spasms, convulsive disorders, seizures, and preoperative sedation. So there's a table 18-4 in your text that lists the anti-anxiety medications. So we have Vistarel, we have Xanax, which is very highly addictive, Librium, Klonopin, Transine, Valium, and Ativan. So medications for specific disorders such as panic, anxiety disorder, as well as generalized anxiety disorder. So we have three different categories that are utilized and effective, and that's analytics, antidepressants, and antihypertensive medications. Antihypertensive medications are generally the beta blockers and the alpha 2 receptor antagonist drugs. And for our analytics, refers to table 18-4, and then we also have some antidepressant drugs that is used to treat panic disorder. So clomipiride and fluoxetine have been the most successful drugs to treat body dysmorphic disorder. Clomipiride is a tricyclic antidepressant, and fluoxetine is a SSRI antidepressant. So for OCD, SSRIs have been approved by the FDA to treat OCD disease. So we have our fluoxetine, paroxetine, sertraline, fluvoxamine that have been approved to treat and have been successful in treatment of OCD. So self-awareness for the clinician. The nurse must recognize that obsessive compulsive disorder patients are aware that their behavior is senseless. So repetitive washing of your hands is senseless and can cause harm. So it is non-productive or non-therapeutic for a nurse to say, just find something else to do, find a hobby. Even though it may be difficult for individuals that are not struggling with this disease to understand why a person can't just stop doing an activity. But you have to recognize that OCD is a disease, a psychological disease or emotional based disease, but it's very similar to treating a physically based disease. So just think of asthma or something that's physical. This is a disease process as well, even though all you see is the behaviors. You don't really get to see the actual internal wound that they're struggling with because it's psychological. But the nurse needs to recognize that they have periods of waxing and waning. So on periods of time, individuals with this diagnosis will appear perfectly normal and be functional in society. And when these individuals are feeling overwhelmed by the disease process and it is interfering with their everyday life, that's when they usually will seek treatment.